Hey, again.
From our lighting. I can do first. You want to go first? You go first. Can what's your name and the date of birth, please? Your name and date of birth. All right, thank you. So my name is Michael. I'm a student nurse, and today my purpose of being here today is for health to assessment. Is that okay with you? All right, thank you very much. Do you need to use the washroom? Do you feel any pain? So I'm going to ensure privacy. So again, what's your name and your date of birth?
Date of birth and 29/11/2006.
And your name?
Dave.
David. Okay, where are you right now?
Seneca.
Seneca. All right. And what month are we? What month are we?
April.
April. Okay, thank you very much. So patient is alert and awake and oriented to person, place, and time. So now I'm going to be doing physical appearance. Your skin color is even and consistent with other parts of your body. There is no notable body odor. So for body structure, can you stand up, please? Okay. Both halves of your body is bilaterally symmetrical. There is no obvious deformity, and your posture is upright and erect, and you look well nourished with even distribution of fat and muscle. Then you can sit down, please. Then for behavior, you maintain good eye contact. Your mood is good and appropriate for occasion. You have good hygiene, and your speech is articulate. Then now I'm going to be inspecting your facial structure. Both halves of your face is bilaterally symmetrical. There is no involuntary movement. There is no visible scars. There is no visible masses, and the skin color of your face is even and consistent with other parts of your body. Then the next now I will be testing for facial nerve 7, which is the cranial nerve 7, which is facial nerve. Can you please smile? Can you frown? Can you puff out your cheek? Can you raise your eyebrows? Please, can you remove your eyeglasses, please? Can you close your eyes, tighten it? So I'm going to pull against resistance. Okay, so patient is able to do all I asked him to do, and on both sides of the face it occurred symmetrically, and therefore cranial nerve 7 facial nerve is intact. So now I'm going to be inspecting the eyes. Both eyes are bilaterally symmetrical. The sclera is white. Both eyebrows there are evenly distributed and symmetrical. Can you close your eyes and open it? Okay, there is no lid lag, there is no topsis, there is no strabismus, there is no anisocoria. So I'm going to be testing for cranial nerve theory, which is ocular motor. So the first I'll be doing reactivity to light. The first is the direct. So look straight. So I'm going to shine it. So the pupils constricted to about 1 mm. So I'm going to do for the other one. The pupils constricted as well to about 1 mm. So I'm going to give you like a few seconds so that your pupils can dilate. look straight ahead as well. So I'm going to do contextual light. So I'm looking at this side. The pupils are actually constricted as well. So I'm doing the same thing while looking at the other side. The pupils actually constricted. So finally, I will be checking for accommodation. So you look straight ahead. Okay, so I'll be bringing this close. Okay, so both pupils converged, meaning that the eyes are the pupils are accommodated. So for pellar, pupils are equal, they are round, they are reactive to light and well accommodated. So the next, that means cranial nerve 3, ocular motor is intact. Then for the next, I'll be looking at the ears. Both ears are bilaterally symmetrical. There is no discharge. The nose, the nasal passage is patent. There is no discharge. There is no crusting. For the lips is pink. There is no lesion and is well hydrated. So now I'll be testing for cranial nerve 9 and 10, which is glossopharyngeal and vagus nerve. So what you can you open your mouth and say ah? So the ovular soft palate lifted up and there was no deviation. So it was in the midline, meaning that cranial nerve, the cranial nerve is intact. So the next will be cranial nerve 9 and 10 is intact. That's what I just said. The next will be for the hypoglossal, which is cranial nerve 12. Can you stretch out your tongue? Move it sideways. Okay, and the other way. Thank you very much. Then can you say light, tight, dynamite?
Light, tight, dynamite.
So there was no tremor noticed why he said light, tight, dynamite, and the tongue was in the midline as well, meaning that cranial nerve 12 is intact. So I don't know if I've done okay, that's okay. The next I'll be doing the neck. I'll be inspecting and palpating the neck. So upon the tranches in the midline, there is no the spinal process at the back of the neck appears to be in a straight line. There is no scar, and the guyeta is not enlarged. The skin on the neck is consistent with other parts of the body, and the neck is the head is well positioned on the neck, so it is red. So I'll be testing for cranial nerve 11, which is spinal accessory. So can you raise your head up and down? Can you rotate it to the sideways and the other way? Can you stretch your shoulders? Okay. Can you rotate it to the side against my hand? The other way. Then again. Okay. So patient was able to perform all range of motion without limitation and even with against resistance, meaning that cranial nerve 11 spinal accessory is intact. So the next now I will be going to the lungs, to the posterior lung. So please can you pull your shirt, please?
So patient able to perform
Yes.
the test and with equal strength and no difficulty. Therefore, cranial nerve number 11, accessory spinal.
So I'll be inspecting the tongue, the posterior thorax. So the thorax is symmetrical with downward sloping rings. The spinous process appears to be on a straight line. There is no visible scars, there is no visible masses. And the ribs is at an angle of about 45 degrees in relation to the ribs. So and there is no obvious deformities. There is no scoliosis or kyphosis. So the next I'll be palpating the
shape is,
posterior thorax, starting
shape of the
from
thorax is normal.
here at the apices. Do you feel any pain or tenderness? Please let me know if you feel any pain or tenderness. Any pain or tenderness? Okay.
Deep breath, please.
So there is no tenderness, and also can you take a deep breath in and out? Okay, so and there is symmetrical expansion of the lungs. There is no palpable masses. So and the temperature is warm and within normal limits. So I'm going to be auscultating the posterior thorax.
You have 5 minutes left, okay?
I'm going to be auscultating the posterior thorax. So I'm starting from the apices.
There is no adventitious sounds such as wheezing and crackles. And then the posterior thorax is warm to touch and dry. Okay. Now I'm gonna do the apical pulse. Please. Thank you. So the apical pulse location is in the mitral valve. It is on the left mid-clavicular line, on fifth intercostal space. Now I'm gonna be doing my landmarks.
So upon osculation between the scapula, I heard bronchovesicular sound, which is moderate to high pitch sound. Then at the peripherals of the lung, I heard vesicular sound, which is low pitch sound. So I'm going to the cardiovascular. So it's the apical pulse. So the apical pulse location is at the mitral valve. It's located at the mitral valve, the fifth intercostal space, mid-clavicular. So I'm going to landmark it. So this is the sternum, first intercostal, second, third, fourth, fifth intercostal, mid-clavicular. So line. So I'm going to auscultate it for
30 seconds.
For 30
I know
seconds.
That the patient beats per minute is 42. I'm gonna times it by 2, so it's gonna be 84 beats per minute. The rhythm is regular. There is no murmurs, no extra hard sounds. S1 and S2 is present.
So upon auscultation, the pulse rate is about 72 beats per minute. The rhythm is regular and it is banding. And also I will also check for adventitious sound with the bell. So, and also in that I heard with the diaphragm I heard S1 and S2 sound. Then with the bell, there was not, I didn't hear S3 and S4 sound, no adventitious sound, no gallop and this. Now we are going to the abdomen examination. So can you lie down, please? So can I use this to just cover the upper chest? So now, there is no scar. The umbilical is in the mid-line. The abdomen is symmetrical, and there is no visible pulsation of parastistals or abdominal distension. Now I'm going to auscultate the 4 quadrants of the abdomen, starting from the right lower quadrant. So this is this. Then and to the right of left upper quadrant.
On for all 4 quadrants. The sound is
And left lower quadrant.
normal active.
So for the four quadrants, I had normal active vowel sounds about 10 to 15 beats per minute, and it's a high-pitched gurgling sound. No adventitious sound head, no crackling, no adventitious sound head. Now I'm going to do the
You
palpation.
have 1 minute left.
So for palpation, I'm going to palpate starting from the right lower quadrant.
No tenderness.
So you tell me if you feel any pain. There's no tenderness, no muscle guarding. You feel any muscle guarding? No rigidity and no turgidity for that. So that's it.
Okay, good job.
Thank you. I'm sorry I had to rush.